Hello, everyone. This is Diane, and Nancy is with us as well. Today, we're going to be resuming our CBC Decoded series. Nancy will be talking about CBC, what CBC with differential means, and explaining what those tests are, what those test results mean, and how you can improve your health by understanding that information. I'm handing that over to Nancy right now.
Thanks, Diane. So last time we talked about when you get a complete blood count ordered, typically it's just a CBC. Sometimes a differential will be ordered with it, and that is a breakdown of the white blood cells. But a review of what we went over last time, it was the red blood cells and the hemoglobin in those cells, how many cells there are, the hemoglobin amount in each cell, how big the cells are, etc. Then there is the white blood cell count and a platelet count, and sometimes a reticulocyte count, which is younger red blood cells. The differential, when it's added, takes that white blood cell count, or WBC, and breaks it down further into types of white blood cells. White blood cells are known as leukocytes, and they're a very critical component to our immune system. They defend the body against infections, diseases, and foreign invaders. So the first thing that you'll see in a differential, and this is done, it's automated today, this breakdown of white blood cells. It used to be manual, where we would actually take a drop of blood and smear it onto a slide and look at it that way and actually do a manual count. If there's something that's out of range, either high or low, the technologist will also do that manual look again. So what they're looking at, the first thing they look at are something called neutrophils. And neutrophils are the most abundant type of white blood cells that we have, making up about 50 to 70% of the total white blood cell count. They're the first responders to bacterial infections, where they engulf and destroy bacteria and other pathogens through a process called phagocytosis. And literally, if you Google that, you can see how a white blood cell engulfs a foreign particle, bacteria, whatever, and literally dissolves it, digests it. Elevated neutrophil accounts indicate a bacterial infection or acute inflammation. So when you're deciding between a bacteria and a virus, the doctor can look at the neutrophils, and if it's high, they can guess that it's, without further testing, they can get an idea that it's bacterial. The next one is lymphocytes. Lymphocytes make up about 20 to 40% of the white blood cell count and include T cells, B cells, and natural killer cells, or NK cells. The function of these T cells are involved in cell-mediated immunity, and that directly attacking infected or cancerous cells. T cells are very important in the foreign body aspect, like the cancer cells.
And transplant cells. When you're going through a transplant, that's very important that those stay under control, those T cells. Because it'll be rejection.
So that's an indicator of rejection?
Yes.
You have more experience with that than I do. The B cells produce antibodies, which are proteins that target and neutralize foreign invaders like bacteria and viruses. So your B cells will take that imprint and keep that imprint. So some viruses and some bacterial infections you get once, and that's it, one and done. Not all of them, but that can happen. Elevated lymphocyte levels may indicate a viral infection, while decreased levels can be seen in conditions like HIV and AIDS. The next one, it's monocytes. They constitute about 2 to 8% of the white blood cell count, and they're the largest type of white blood cell. They're on a visual smear, and I'll throw some photographs up here, photomicrographs up here, so that you can see what these cells look like. They're big, not easy to identify in a manual read. They're responsible for the phagocytosis also, but they also differentiate into macrophages and dendritic cells, which help in antigen presentation and the initiation of the immune system. So monocytes will spark a different road in your immune system. High monocyte levels can indicate chronic infections, autoimmune disorders, or certain types of leukemia. Eosinophils, these are my favorite. They account for 1 to 4% of the white blood cell count. They play a role in combating parasitic infections and are also involved in allergic reactions. Mine are typically higher than normal because I have a lot of respiratory allergies. Elevated eosinophil levels are often seen in parasitic infections, allergic diseases like asthma, and certain autoimmune conditions. Now, when I say elevated, I'll throw mine up here. You can see it's a little bit higher. Sometimes it can be really high, and that's where you get into the autoimmune conditions and the more complex conditions that a doctor's going to do further testing, or a clinician will do further testing. Basophils are the least common of the white blood cells. They comprise less than 1% of the total white blood cell count. They release histamine, my favorite. Consequently, taking antihistamines combats the allergy effect of the B cell or the basophils. They also release other chemicals during allergic reactions that are involved in the inflammatory response. Elevated basophil levels may indicate allergic reactions, chronic inflammation, or certain other blood disorders. There are specific blood disorders to basophils, but again, those would be a little bit higher than, I think on mine, I'll throw mine up here. I have basophils. Either they're in the normal range or always there, sometimes a little bit higher. This differential really helps the clinician, whether it's a physician or a nurse practitioner or a physician's assistant, to differentiate between bacterial and viral infections, identify immune disease potentials, allergies, and immune deficiencies. Again, with the really low counts, you're looking at immune deficiencies. Hematologic disorders, which are like blood cancers like leukemia, lymphomas, and myelomas, and inflammatory conditions, chronic inflammation, and it helps the doctor move into looking for underlying causes. So there's a lot of information in that. And I will have places for you to go and look up exactly what these are to do your own research, because that's what we do at Nathan Lee Foundation. We help people better understand what it is that their doctor has told them, what their lab results mean. But always remember, ask questions. If there's something that you don't understand, ask your clinician. And if it's not clear when they answer, ask again. So, Diane, do you have anything to add?
No, I just like to reiterate what you just said. We're not clinicians. We don't provide diagnosis. We are just here to give information, a place for you to go as an introductory to a CBC in this case, and with the goal that be encouraged to be informed to, keep on top of your own healthcare. But always, as Nancy says, always ask questions. And if you don't understand, ask them again. And if you still don't understand it, ask them again. I sound like a parrot sometimes when I go to the doctors. I'm like, well, what do you mean by that? And then the explanation is given. And then I ask another question. Why does that happen?
Yeah.
So
Ask until you're fully satisfied.
until you know, right? And well, why is my X test so high? Or why is it reading like way below normal? Am I fighting an infection? Is it my allergies? Or I get all nervous when I see some of the tests and I'm like, do I have some autoimmune disorder or not? And I may just be fighting a cold. And I get sick like 2 days later and I'll say, oh, that's why.
Very true. And if we're always open to answering questions and leading you in the right direction to get your answers, for sure. So remember to like us, share, and subscribe to our channel. Thanks and have an amazing day.
Thank you, everyone.